There's still the old lipo scar. So, dense scar tissue stuff.
Hey Melissa, how are you? Thanks for joining us. Dr. Phillips is currently in surgery. This patient came to see him for Lipo 360. Let me know if you have any questions. This patient's procedure is going to be on YouTube as well. So you can join us over there if you'd like to see the operations. Melissa, we're doing really great here. It's almost 11 o'clock, so we got a little a later start than usual, but it's a wonderful day. The weather outside is really nice. It's not like scalding hot anymore, which is very nice. Got any exciting plans for this week? Hey Brenda, yes, this is live. As you can hear, Dr. Phillips is currently doing some vaser, so prepping this patient for some liposuction.
One corkscrew, 1, 2, 3, 4, 5 laps. One blade.
You bet, Melissa.
We're good.
Thank you so much for joining us. I hope you have an amazing day.
We got problems.
Yeah, they got problems.
Again, this patient came to see Dr. Phillips for some Lipo 360 and Renuvion. As you can hear in the back, that noise that kind of like a screeching noise, that is vaser.
Instagram, TikTok, and YouTube.
Uh-huh. Wait. Yeah. Yeah.
YouTube also? You wanted YouTube?
Yeah.
Oh, okay.
Hey Brenda, what kind of makeover is he doing? Yeah, so Dr. Phillips' patient came to see him for Lipo 360 and Renuvion. So that is going to be suctioning the fat in various areas on this patient's body. As you can see right there, Dr. Phillips is doing some vaser. So that's just the step before liposuction. It helps to like prepare for liposuction. It makes it so that the fat is easier to extract, if you will, like suction up. And so that's all this patient came to see Dr. Phillips for this time around. Just wanting that extra stubborn fat in certain areas of her body gone, so that she looks more snatched, thinner. And Lipo 360 is a great option if that's all that you want. You don't want anything too invasive. You just want that fat gone. So that's what this patient opted for. Again, you can see Dr. Phillips is just doing some vaser on the patient's arm. This patient is going to have some lipo done on the arm. So again, that's just going to be like suctioning that fat that's there on various parts of the back. And then we'll probably take a break to flip this patient over, and then Dr. Phillips will resume some lipo on the patient's front side. So doing the stomach, the abdomen, and on the sides. Again, let me know if you guys have any questions. I'm going to go ahead and pin a form. If you'd like to get in contact with Dr. Phillips' team, you can start by filling out that form. And from there, it'll collect your information. Whoever receives that form will reach out to you. They'll give you a text, a phone call, an email, whatever your preference is. And from there, we can get you set up with a consultation, either in person, virtual. We can talk about pricing, give you a quote for the surgeries that you are interested in having done. We can figure out pricing for you. Hey Melissa, my hubby is watching with me too. He says hey to y'all. Well, tell him we say hey back. Hope you guys are having fun watching. Let me know if you guys have any questions. Like I mentioned, it's just Lipo 360 with Renuvion, so it's going to be pretty quick today. Just as you can hear in the back, Dr. Phillips is doing some vaser. So again, that's just prepping before liposuction. And then Dr. Phillips will go in and suction all that fat where he did the vaser, and then go in with Renuvion that helps to tighten the skin from the inside out. And we're showing this on YouTube, so if you guys would rather see than hear me explain it, go join us over there. You can find it in our link tree. It's going to be all the way on the bottom. But you should see the little icon for YouTube, and it'll take you right over to our live. Hey Tammy, if there's any kind of an emergency, you should definitely not be here. You should probably contact somebody who can respond to you. We can't really do anything, unfortunately. I'm sorry, but you can call the emergency, go to the emergency room, get in contact with a local provider. Brenda, what is typically recover time for this procedure? Yeah, so the typical recovery time for this procedure is going to vary patient to patient. It's going to vary patient to patient, but since it's just Lipo 360 with Renuvion, it's not too invasive. However, it can be, you can feel sore after liposuction because the candula, the tool that's used to basically suction all that fat, is can be pressing up against your skin. And so you can feel sore afterwards. You might have a little light bruising afterwards, but generally you're gonna want to take about 2 weeks, 1 to 2 weeks off of work. If you work remote, that's probably better for you. Hey Tammy, don't do that. I don't have any resources for you. However, if it is an emergency, I would call 911. Or call somebody you know personally that can help you right now. If I could direct you to somebody, I would, but unfortunately, I don't know. We just answer questions about plastic surgery, more specifically what Dr. Phillips is doing. I'm sorry, Tammy. Again, if it's an emergency, call 911. Is it common to do more than one procedure at a time? Yes, it's very common actually. More than not, patients will kind of double up on surgeries. They'll have a couple procedures done all at once, and that is just so that they don't have to go through and schedule multiple recovery, or excuse me, so that they don't have to sit through multiple different recovery phases, if you will. So if they were to just take a surgery one at a time, they would have multiple different, they would have to take a lot of breaks basically from work just so that their body could heal. But if they, get all of it done in one day or at one time, they don't have to go through all of those breaks. They don't have to recover several different times. They can kind of just be done. It's like a one and done, if you will. Hey Tammy, let me know if you're still on. I hope you're doing okay. Again, call 911 if it's something serious. Sometimes it's advised that you do one procedure at a time. Your body will heal better that way. However, of course, we see it all the time. People just want to get it all done at once, which is totally fine as well. As you can hear there, Dr. Phillips is now getting started on liposuction, so that is suctioning the fat. So earlier Dr. Phillips was just doing some vasers, so preparing the body for liposuction. Of course, Brenda. Let me know if you have any more questions. Like I mentioned, we'll be here for a little while. Lipo 360 doesn't take too long, but we'll end up taking a break and going back, coming back on. Yeah, Brenda, we'd love to get in contact with you. Let me know. If you follow any of our older social media platforms or you visit our website, we can basically from there set you up with a consultation, get you in contact with our team, in contact with Dr. Phillips, you name it. And so as you can hear in the background, Dr. Phillips is doing liposuction again. If any of y'all would like to see rather than hear, you guys can join us on YouTube. It's going to be linked in our link tree, or you can find it at Dr. Jeneby Plastic Surgery. Over there, we flip the camera over so you guys will be able to see everything that's going on in the OR.
$300 left flex.
Again, this patient came to see Dr. Phillips for some lipo 360 and Renuvion. So right now, Dr. Phillips is doing some lipo on the patient's back. And then from one side, he'll go to the other. Do the exact same thing, and then we'll take a break and flip her over, and then come back for the rest of this patient's liposuction. And so we're also, like I mentioned, we're also on YouTube. So over there, the camera gets flipped and we actually show what's happening in the OR, the procedure, Dr. Phillips. So if that's something you can tolerate, you can tolerate blood, I would highly recommend. A lot of future patients and potential patients like to check us out on YouTube. They just like to see what's happening in the OR, what could be happening during their surgery. And
400
so
left back.
on YouTube, that kind of gives them an idea. Hi, Melissa. What subcutaneous sutures will be used? Interesting question. Not sure. Can always ask. With this patient just getting lipo done, I'm not really sure. Let me ask. Hey, Dr. Phillips. What subcutaneous sutures will be used? Somebody asked.
No, this one.
Okay. There you go, Melissa. With it just being lipo 360 and Renuvion, Dr. Phillips isn't really having to incise at all. So like making incisions.
200 left arm.
So like you heard.
No sutures on this case.
There you have it, Melissa. Let me know if you have any more questions. Again, as you can see there, Dr. Phillips has moved to the other side of this patient and is now finishing up or doing some more lipo. Like mentioned, Dr. Phillips will go in with Renuvion after. In the areas where he did liposuction.
Right foot.
know if you guys have any questions. As you can hear in the background, Dr. Phillips just doing lipo 360 again. This patient came to see Dr. Phillips for lipo 360 and Renuvion. So we'll be live for a few more minutes before the flip. During the flip, we take a break to flip her over, and Dr. Phillips will resume liposuction on the patient's front. As you can see on YouTube, Dr. Phillips has just been on the patient's back doing lipo. Patient also came in for Renuvion. So Renuvion helps to tighten the skin from the inside out. It heats up the skin underneath the skin and causes it to contract. I couldn't find the Instagram page. Leah. Okay, let me see if I can type it. So, like I mentioned, it's Dr. Boom Pow for Dr. Jeneby. It should pop up as the same profile picture as the one you see here on YouTube. If not, you can try looking under, typing in the name Dr. Jeneby plastic surgery. So at the end of Dr. Boom Pow, it's POW. Try that and see if it works. Alright, y'all, we're going to go ahead and take a little bit of a break. Our phones are about to die, and Dr. Phillips is soon, this patient is going to be flipped over soon. So I think now's a good time for us to take a break. But we'll come back to show the rest of this patient's lipo 360 and Renuvion.